Our outcomes, what to measure. Today is the first in our outcomes series. I'm going to spend just a couple minutes going through some housekeeping and then turn it over to our presenters. Today's webinar is being recorded and will be posted on the MCTAC website. We do encourage you to use the chat box and chat to all panelists throughout the presentation, any questions or comments you may have, and we've set some time aside at the end for Q&A. Okay, so just a little bit about our presenters. We have with us today from CCSI Senior Consultant David Warsnick. You may recognize him from the Bags of Money series that he did with MCTAC, and we also have Naomi Weinstein, who is the Vice President of Innovations at ICL. And both David and our ICL partners are going to be helping us out throughout the series, so stay tuned for more from them after today. So this is our general MCTAC slide. As all of you may know by now, MCTAC provides training and support to mental health and substance use providers in New York State. And this slide shows you all of the MCTAC partners. And this slide shows you all of the Small Business Initiative partners. And if you're not familiar with the Small Business Initiative, we are a group of MCTAC partners who is charged with helping providers who have less experience or are new to billing Medicaid. Okay, so just a reminder, like I said earlier, this is the first in our series. We've got a series coming up pretty much every 2 weeks from noon to 1, with the exception of the one on April 5th, which is being held from 1 to 2. So this series promises to take you through the journey of identifying your value, collecting and analyzing data, and using data to inform practice and empower staff. So before I pass the presenter ball along to David, who's going to get us started today, just one more quick reminder to please use the chat box and type your questions in as they come along. Okay, so pass this along so that David can get us started. So here you go, David.
All right. Thank you, Daniela. And again, welcome everybody to the first in our four-part series. The agenda today, as you saw on the slide before, we're really trying, and as Daniela had talked about, we're really trying to look at this as some really hands-on kind of information for you to begin your journey, if you haven't started yet, or maybe enhance your journey depending on where you are, in understanding outcomes, how they're measured, where they fit into the broader scheme of things, how you can take that information and communicate it across the number of stakeholders in your consumers, your staff, payers, governmental organizations, networks that you may be involved in. It's interesting. I was having this discussion with our leadership team this morning, is that how quickly our lives have changed to a point of maybe 5 years ago when all the conversations about data and outcomes were beginning to start. And there wasn't a lot of data, there wasn't a lot of skill sets to today, where there's almost too much information. We have, and the process of beginning to take a look at all the different data we have, deciding really what's important, what do we need to be measuring, why we want to be measuring it, and what we're going to do with that data. So today we're going to start right at the beginning. We're going to start a little bit with the current environment and the challenges ahead. This is not going to be new to everybody, but to probably anybody. But I always like to start with a shared context, make sure that we're all at the same starting point and really have a good understanding of why this is all happening and where we fit into the picture. So we'll talk a little bit about current environment challenges. We'll go through some definitions. What's value? What's an outcome? Why are they important? Then we're gonna work a little bit on and Naomi's going to talk with you about some outcome planning tools. I'm going to talk a little bit about value propositions, which we really see as the starting point. I like to think about this as, you know, figuring out, measuring what matters. What matters is what matters to your consumers, what matters to your payers. And I think that by the end of today's session, hopefully you'll have a clearer idea of what you need to be looking at and what you should be thinking about, what your outcomes are, and what you need to begin measuring. So, you know, New York State has a vision of what quality is. We're going to be talking about quality and value and outcomes, how they sort of work together. New York State's quality vision is of a service delivery system that's client-centered, recovery-oriented, integrated, and the last one there is value-based and outcome-driven. And that's really the focus of today's and the subsequent presentations is value and outcome and measurement and reporting. So it's the ultimate goal of measuring, reporting, and comparing health outcomes is to achieve the triple aim of healthcare. You've heard about this before, I'm sure. The triple aim is to hold costs in line, you know, sort of change the needle, move it down a little bit, affect cost increases, provide services more efficiently and more effectively, increase quality. Our conversation today about outcomes will be speaking specifically to how you might think about measuring that. Then the other piece of this that doesn't get as much play, I think, is the experience that your consumers have with the healthcare system. So we're really then looking to be more efficient, provide better quality services, and provide a better experience for our consumers. Recent changes in the healthcare environment. Well, you're out there, I'm out there, and I've been doing this for 32 years now, and this is by far the most difficult environment that I've seen inside of behavioral health. The demands on us as providers have exploded in the last couple of years. And I mean, these are just a couple of the recent changes that you're seeing. Certainly the DSRIP project as part of the Medicaid redesign, you know, that integrated all services into Medicaid managed care. The movement to the value-based payment structure along New York State's roadmap. You can certainly add others to these, the standing up of the home and community-based services, the movement to, in the pilot project New York State's doing around certified community behavioral health centers, projects that you may be having with network affiliates. But everything that we're seeing now has a component to it that we're calling value-based and outcome-driven. So the transformational changes that are occurring in the environment really have at its core a requirement for us to be thinking about our value and measuring our outcomes. You know, as we think about the future, it is critical that we become better at this. And so hopefully some of the things we're going to show you over the next 4 presentations will assist you in that area. So we have a couple things we've talked about. We've talked about outcomes, we talk about quality, and we talk about value. I think that it's important to have an understanding of what value means. And payers and consumers, they're seeking value, but what really is value? Value is the combination of the quality, the services you provide, and the cost that you provide them at. It's really, I mean, you took a look at the triple aim, and cost is a factor here, the quality of the amount of services that you provide. So when you think about value in your organization, you think about quality, you think about cost, and you think about service delivery. And it's high quality, accessible services at an efficient cost. And that's really what your payers, your consumers are going to be looking at as the definition of value. So we've always looked at cost, we've always looked at service delivery. I mean, that's really been a cornerstone of what we've been looking at prior to the changes that have been going on over the last couple of years. What's new here is quality, and quality is measured through outcomes. So that's how we conceptualize the concept of value. Now that we've talked about what we mean by value, what do we mean by outcome measures? And so outcome measures are the benefit or changes for people that result from participation in program services. I think the two key words here in this definition are benefits and changes. Outcome measures is a process of quantifying both. Having tools that will allow you to determine where people are, how they are changing, and how they may change around a couple different dimensions of their knowledge or their attitudes, how their behaviors may change, how their conditions may change, their behavioral health conditions, their physical health conditions, how their status may change, their tenure in the community, those kinds of pieces. The World Health Organization's definition is a change in health of an individual, group of people, or population that is attributed to an intervention or a series of interventions. You're hearing the phrase now a lot about population health management. And as you see, the World Health Organization really takes sort of a broader view of individuals in groups, and individuals as part of populations, and how what we do and the rest of the service delivery system, including the healthcare, the social service delivery system, what it is that we do, the interventions that we bring to the table that changes people and returns value to our consumers in the community. And that's really what we need to start measuring. These are the outcomes. A couple of examples about outcomes. So what's an outcome? So if we measure the increased use of primary care, we would measure the fact that individuals who maybe have co-occurring physical health disorder are more integrated with their primary care physician or specialist in management of their diabetes, as an example, or management of their cardiovascular disease. So are they, in fact, have they changed their behaviors or changed their attitudes about their physical health condition? A decrease in psychiatric emergency room visit. Again, have they changed their behaviors? Are they more integrated into a more mainstream healthcare service delivery system? Are they more involved in changed their attitudes and changed the behaviors around preventative care? The way they think about, or the way they think about their health conditions or understand their health conditions. The increase in the number of people who quit smoking, or use substances inappropriately. There's other outcome measures around people's change in their behaviors around their use of their medication and medication compliance. And you'll see that there's a number of different outcomes out there, and these are the changes in folks' behaviors, status, conditions, and how we would measure those. things that aren't outcomes, sort of PROS, number of therapy sessions you provided, that's not an outcome. It's a measure. Number of people you serve, current census, those kind of things, those really are not what we're measuring for outcomes. So when I think about outcomes and measurement of outcomes, I think of it as a process. And it's not only a process of measuring, it's a process of using the information to really inform what we do as providers and how we intervene with our consumers. And as we monitor outcomes and we monitor the changes in the individuals that we serve, there is an expectation that we then use that to inform our practice. Measuring outcome allows us to narrow our focus a little bit. And as we measure outcomes and as we then take those outcomes to inform our practice, to make changes in the way that we provide services, the state and the federal government and really think that this is going to really help the service delivery system to be able to improve access and engagement in community-based behavioral health services. Yeah, so one of the things that you're going to be seeing coming down the line as we talk about what we should be measuring is access is going to be a huge piece that we're going to be evaluated on. You know, can somebody call you today and get an appointment this afternoon for an assessment? Do they have access to emergency services? So one of the things is that we're going to be measuring our ability to open access to people to when they need services, where they need services. Increased use of evidence-based practices that integrate behavioral and physical health services. Also integration, best practices that focus on different types of populations. Again, as we begin measuring the outcomes and measuring the changes in our clients, we need to be thinking about the populations we serve, the outcomes that we're getting for the interventions of these populations, whether there are better evidence-based practices that we need to apply to individuals in the populations that we serve. Improve healthcare coordination and continuity of care. Again, as we measure our outcomes, we would anticipate that we're certainly going to look more closely at the co-occurring physical health disorders, our individuals' understanding of their disorders, the coordination that we have with physical health providers. I talked with people, you know, a lot of times the consumers that we work with have a closer link to the behavioral health provider community than they do to the physical health community. Part of our job will be able to ensure that we have a better integration with physical health. We understand physical health needs, and the physical health community understands the behavioral health needs, and we do a much better job of coordinating that as we measure our outcomes and find out where we may be lacking in these areas. It's anticipated that we would do better at this. And the piece, reduce avoidable behavioral health and medical inpatient admissions and readmissions. You're going to see this certainly, and I'm sure you've seen it now in some of your district projects, is that a main focus of what everybody's looking at is to keep people in the community, wrap the services around them that integrate the physical health needs that may lead them to hospitalizations and also the behavioral health needs. So again, for me, this measuring outcomes is a process. It's how you take these measurements, how you use that to relook at what you're doing, how you're doing, and the benefits that you're providing to your consumers and your community. Of course, there's other reasons to monitor outcomes, and some of them I'm sure you're doing already. There's reporting requirements, outcome reporting requirements. I've been with Spectrum Human Services here for 30-some years, and we have a series of outcome measures that we report to county, of outcome measures that you may be reporting, that data that goes for your ACT programs or your PROS programs or into the care system. So, reporting is not an insignificant requirement that we have for measuring outcomes. Supporting clinical decision making, I talked a little bit about that in terms of your measurement is, can you make better clinical decisions? Can you use clinical support tools that measure outcomes to help you change your interventions, rethink it, bring evidence-based practices forward, evaluate efficiency? I think that we've been trying to do that for a long time. It's going to become an even more critical piece going forward. There's a lot of uncertainty right now, and will continue to be for a while, and the kind of funds that are going to be available if for Medicaid for providing these types of services to individuals in New York State and around the country. I think the demand for efficiency is only going to increase and become more difficult as we move forward. Forming program development, you measure your outcomes and you find that you're finding a gap in an area because you have a gap in your service delivery system that you think you're uniquely qualified to provide. You take that information and really use it to inform your program development, or even to work with your local governmental units to talk with them about service delivery systems and what they may want to be thinking about funding in your community, integrating services that are already existing, and certainly can support advocacy and strengthen fundraising. And we'll talk a little bit about this as we get to value proposition, is once we can measure and quantify the benefits that we provide to our consumers, to the community, how our benefits can be financial and quality of life and decreased demand on high-cost services. That is an important piece that we can then use to advocate for funds, solicit funds from foundations, from individuals in the community, advocate to the local governmental units. So these outcome metrics really become a critical piece for us as we think about enhancing our role in the healthcare industry and providing better services to our clients. Long-term vision, continuous quality improvement. I talked about that. That's a critical aspect of this. Is we're going to use our outcome measures. We're going to use it to help us understand our clinical services. We're going to use it to do our planning, for our staffing, for service delivery, for use of evidence-based practices. And we're going to see improvement in the health of individuals in our community. And, I think that this is an important piece. We really need to work very aggressively in reducing the disparities in health outcomes for people with behavioral health conditions as compared to the population as a whole. So that's sort of setting the stage a little bit. I'm going to turn this over to Naomi Weinstein, who is going to be talking a little bit about some of the processes that you can put in place to begin thinking about how you would decide what to measure. Naomi?
Great, thank you. So as Dave just said, my name is Naomi Weinstein, and I work at ICL. So I'm going to talk with you right now about how to figure out which outcomes to measure. Now, some of us are brilliant, and we can just glance at a program and know exactly which kinds of outcomes we should be looking at. And some things are obvious. But sometimes it helps to take a step back and think through in a structured way what we think we want to be looking for in terms of outcomes. So we wanted to talk to you now about two different tools. One is an outcomes planning tool, and one is a value proposition. So first, we're going to talk about the outcomes planning tool. Let's see. Okay. So an outcomes planning tool is something that many of you know as a logic model, and probably some of you are now groaning when you hear that word, especially if you've written certain kinds of funding proposals, you've had to do logic models in the past. For some people, this seems kind of overwhelming. For other people, piece of cake, nothing really there. I think the benefit of an outcomes planning tool or a logic model is that it does force you to slow it down and think very strategically about, do you have the resources to impact the kinds of changes that you want to see happen? Also, an outcomes planning tool is, because it's supposed to be written out as opposed to just in your head, a conceptual kind of thing, is it helps you look at the relationship between which resources you have, what you are planning to do with those resources, and what comes out of it in the end. All right. So here is kind of our sample outcomes planning tool. Your first step, of course, is to figure out, just to make sure everyone's on the same page about who is your program serving, right? Are you serving adults or are you serving teens? If you're serving teens, is it an 18-year-old teen? Is it a 21-year-old teen? Do you have limitations on this? And you want to make sure that everyone's on the same page in this. With an outcomes planning tool, it's not ideal that you just know it yourself. You really want to share it with your entire team and make sure everyone is in agreement, because this will help drive what your actual activities are and what you're looking to accomplish. Your second piece of this is making sure everyone agrees. What is your purpose? Is your purpose to make a dent in rates of substance use? Is it to provide stable housing? What's your purpose? And then you start looking at the actual, quote, logic model. And you have inputs, activities, outputs, and outcomes. And inputs lead to activities, lead to outputs, lead to outcomes. So your first thing are your inputs. And you can see here on this kind of sample version, you have staff or facilities or funding or any curriculum you're using or volunteers. These are essentially the ingredients in your recipe, right? If we can just use that food metaphor for a second. So this is your chocolate chips. You can see where my head is. So your chocolate chips and your flour and your sugar and your eggs and your butter when you're going to make chocolate chip cookies. These are your ingredients, right? The next step are your activities. And that's, what are you going to do with your ingredients, your inputs? So in the cookie metaphor, right, you're going to mix, you're going to blend, you're going to cream the butter, you're going to bake the cookies. In our human services example, we might provide counseling or medication management. We might be offering drug treatment or having family sessions. So we're doing a whole bunch of things. And then we have outputs. What happens as a result of those activities? So in the cookie metaphor, this is how many cookies you get, how many people you're able to feed with these cookies, right? Those are your basic outputs. If we think back to Dave's slide earlier about outcomes and not outcomes, those not outcomes, right, so that would be like census or numbers served, those are your outputs, which is very different from the deeper changes that you're looking to see. Ultimately, though, the inputs and activities and outputs lead to outcomes. And that's your changes in knowledge and attitudes and skills and behavior and your condition and your status, right? So in following through with the cookie metaphor, your outcomes are people don't feel hungry anymore, right? Now, you could have a long-term outcome like contributes to greater obesity, right? And that would be a change in condition or status. But attitudes would fit into that, don't feel hungry anymore kind of thing. So you have short, medium, and long-range outcomes. Typically, the short-range outcomes are things like knowledge and attitudes, because those are the things that we are able to effectuate change in the short term. Skills take a little bit longer, so that's kind of an intermediate outcome. And sustained behavior or change in condition, such as, reduced symptoms or a change in status, like employment status, that might take a little bit longer. All right? So let's say you've done all your good work and you have your inputs, activities, and outputs and outcomes, and that's great. But now you want to just stop and say, like, okay, am I measuring what matters, right? So there is a whole bunch of data that you could possibly collect as a result of any kind of activity that you're doing. And there's a whole bunch of the data you don't really care about. So, for example, you might find that, for example, I'm remembering a youth program that I knew of where one of the outcomes that they had was a whole bunch of sexual relationships and then bad breakups that happened between clients, because it was a teen program and all these kids were kind of getting together as a result of that. That's not what they were looking to measure. Now, that's something you might want to track separately, but what they were looking at was decreases in isolation. All right, so you're going to make sure that what you're trying to achieve is what you're measuring. So you're going to think about, what are you trying to achieve? What, for your clients, from their perspective, what would they like to see change in their lives, right? If you're successful, how will your clients be different after the program compared to where they are right now, right? And maybe it's people who are more employed, or people who are able to stay out of the hospital, or people who stay drug-free. What does it mean for them to have a success? Then finally, before you finalize this list of desired outcomes, you want to take a step back a little bit, right? You want to make sure that the outcomes that you've selected to measure are things you can actually influence. So kind of tending towards the absurd, I would guess that none of us, through our individual programs, are going to be able to, for example, cure diabetes. However, we may be able to make a difference in the A1C levels of our population through an integrated physical and behavioral health program model. So what are we able to measure? The second thing is, are these outcomes important to you? Not just what's measurable or what the funders want, but what matters to you. And this helps ensure that your team retains its passion for the work, right? At the same time, you cannot forget your stakeholders, and we all operate in this broader healthcare environment, and it is vital that we are making a dent in the challenges that we are being paid to address. So is this outcome important and valid to others? And then finally, we want to keep communication about outcomes straightforward, right? The language that we're using has to be things that people understand. So this helps keep everyone on the same page about what we're doing and why. Again, that's about our passion for the work. So just as a simple example, if we talk about a decreased rate of fatal myocardial infarctions, people on our team might not connect that up with how many people are dying of heart attacks. So we need to make sure that our language, when we communicate these outcomes, is something that's accessible. All right, and I'm going to turn it back to Dave if I'm able to do this. All right, Dave, here you go.
Thank you, Naomi.
You're welcome.
Thank you. Another tool that you can use is to go through a process of creating a value proposition. I like Naomi's model because it really forces you to take a look at, in part, the mission of your organization, the individuals that you serve, what's important to you, to your clients, and what value do you bring, and what are the short-term, intermediate, and long-term goals that you have. The value proposition takes a similar but a little bit different turn on this. A value proposition is a promise of value to be delivered that considers both quality and the cost of service. It clearly states why your customers want to use your service. It's just a little bit different way of thinking about it. It's saying, okay, you know, this is who we are, this is what we do, and this is why you should choose us to do this, we're moving into an environment that I would anticipate that we're going to see increased competition. There's going to be increased transparency about who we are, what we do. There's going to be transparency around how satisfied our consumers are with the services, how well we are doing in producing quality and helping people make changes. And the value proposition is a way that you begin internally taking a look at who you are, what you serve, who you serve, and why you do it better than anybody else, and then how you're going to use your outcome measures to be able to document and demonstrate that. So again, you want to know why consumers want to use you and your service, and it's really then your value proposition needs to take different forms because there's different stakeholders. You may have a value proposition that you think about using with your clients, patients, consumers. You may have a value because their definition of value may be different than, say, the definition of value by your payers. Your payers may have a very different definition of value, or a network that you may be collaborating with will have a different definition of value. So it's really a consumer-driven statement. It reflects what the customer wants, not necessarily what you want to offer. So this is what we do. This is the population we work with, and this is the value that we bring to the table. So similar to the logic model, you have to go through a couple steps, and you have to say, okay, what do I include in my value proposition? Well, it's what services do I provide? And how do my services deliver outcomes? That is, how do they solve problems? How do they improve lives? How are they a catalyst for change in people's behavior or attitude or status, as Naomi talked about? This takes a little bit different spin and say, okay, what makes our services unique? Why would you choose us? What do we do better than other people? Do we do better at access? Do we do better at cost? Do our outcomes show that our consumers are extremely satisfied? So what makes you unique? Why should, if I'm out there and I'm looking for a service, or I'm looking for somebody to collaborate with, or I'm looking to somebody to contract with, this is the statement of how you envision and what you say, why that should happen. Who am I? This is what we do. This is how we do it. This is how we do it better than anybody else. And you need to, they have indicators of the value that you provide to your consumers and your community. So when we think about the sort of the original question, what do you measure? Well, one of the things is that's important for you to be able to do is to be able to show that you, in fact, return value, and you can demonstrate. And so some of the decisions that you need to make around what to measure, what outcomes you're going to begin using, is what are those measures that are necessary to support our value proposition. So, so if you want to say, basically, you know, we provide, one of the things that we do uniquely is that we provide immediate access to individuals who are seeking service. Well, what would the outcome measure be to do that? You know, the number of calls that people make to initiate an assessment and then are seen that same day. So maybe that's an outcome that you need to bring forward to be able to demonstrate the value that you bring to your organization. So writing your value propositions, you need to think about where you get your input from. You know, don't be afraid to look to your staff and to your organization. You know, we're all mission-driven. We have mission statements. We have values. We have individuals in our organizations who work for us and with us because they share those missions. They're very talented people. Look to them to begin talking about what is the value, why are we different, how can we differentiate ourselves from others. And consumers, talk to your consumers. If you don't have a consumer satisfaction survey, you should probably think about that. The experience of care is going to be an important factor that payers are going to look at, and so begin thinking about talking with your consumers about, why were you here? Why'd you come to us? How did you see the value that we bring to you and to your families and to the community? And then other providers you work with, because you may have collaborative agreements with other folks, and they're working with you for a reason. Maybe they're working with you because you're the only game in town, but maybe they're working with you because you answer their emails right away or pick up the phone when people call them, or you work with them around problems, or you're willing to compromise in areas that it's important. So figure out from your individuals, that providers that you work with, is how they see your value. Bring all those different inputs into play. Who do we serve? How are we unique? What is the value that we bring? Why is it important? And then write your value proposition that's clear and can be easily understood in a few seconds. And it's another process about thinking about ways that you figure out what's important to measure. We've talked about a number of different aspects of what it's important to measure, and the value proposition is just one. And it really helps you assert your value to payers, affiliates, and consumers. And I think it's a really important aspect of what you need to be thinking about, how you really think about your organization and how you fit into the changes that are going on. One of the things in any of these kinds of tools that you use to figure out what outcomes are important for you and what you really need to be measuring is see if that, think about whether your value propositions or your outcome measures are going to align with some of the managed care priorities, or some of the priorities of New York State. And we listed some of them here, improve the life outcomes, improved recovery outcomes, employment, improved experience of care, which we've talked about, rate of unnecessary and inappropriate emergency room visits, reduced rate of avoidable hospitalizations, duplication of service, increased provision of community-based recovery services. So you have a value, and as you think about the value proposition to your payers, which are probably in the case of many of you, your insurance companies, primarily your managed care companies, is what are they measuring? What are they accountable for in their provision of being an insurance provider? And how do your outcomes, how do you align your outcomes in your value to the kinds of expectations and challenges that your payers are having? That's a pretty quick run through of the different types of tools that you could be thinking about using to help you really figure out measuring what matters, measuring what's important to you. Now, there's been, probably for a little while, people have been, I don't think avoiding moving aggressively forward in outcomes, but I think a lot of people are waiting because there's been a sense that, well, there's a lot of different outcomes, and, there's the HEDIS measures, and there's the old PQRS measures, and we don't really know what it's going to be that we're going to be responsible for. And so we'll just think about this a little bit longer, and we'll sort of wait a little bit. But I'm a firm believer that there's really emerging guidance on what's going to be expected of you what's going to be expected of measurement. Even if the specifics aren't there now, you need to beginning doing the logic model. You need to begin really defining your value, figuring out how you're unique, and figuring out what you need to measure to be able to prove that. But I found that there's two really helpful documents out there that if you haven't started this process, I would, at the end of this presentation, I'd run out and bring these documents down. One is relatively new. The first one there is the Health and Recovery Plan Value-Based Payment Quality Measure Set for the measurement year 2017. I believe that was posted on March 13th. And if you bring up that document, you can find that on healthnewyork.gov in the healthcare Medicaid redesign area. These are the group of measures, both behavioral health and physical health, that New York State is going to begin looking to for the HARP population as part of their value-based payment structure. This is the first really clear guidance that I've seen that speaks to the kind of behavioral health outcomes that are going to be important for us as providers going forward. The second one is the outcome measures required by the Certified Community Behavioral Health Center. A lot of folks may not be aware of what this project is, but New York State is along with a handful of other states, is in a pilot project sponsored by CMS to stand up what is called a Community Behavioral Health Center. A Community Behavioral Health Center is a redesign of the clinic service delivery system, and it takes aspect of some of the siloed systems that we're currently providing and bringing them together under a single auspice. So some of the expectations are that your clinic services are fully integrated between your mental health and substance use services, and that's an integrated service delivery system, that you're able to provide services in the community, that breaking down the barriers, the four-wall barriers, providing services including prescriber services, emergency services in the community where people live, where they need the services, adding psychosocial services to the community behavioral health. It's really a bundling of services under a single auspices. And in that pilot project, there are clearly delineated outcome expectations with numerators and denominators and stratification of groups by payers, by age, differentiation between children and kids, expectations around substance use and tobacco use and Medicaid management and treatment for depression. I think these two documents give you a very clear roadmap, I believe, of what's going to be expected of you moving out into the future. And I would very strongly recommend that you pull those documents down and have them in front of you as you begin your logic model around determining what you need to measure, and as you begin to determine what outcomes are necessary for you to be able to prove your value. Real quickly, some other data and we talked a little bit about this, is that, don't forget about deciding what other outcomes you need to measure to support other operational parts of your program, planning, fiscal health, quality improvement, program operations, and other funders to state of maybe additional outcomes you need to put in place. And I think the key piece in here is that outcomes and continuous quality improvement come hand in hand. Measuring something is one thing. Using that to inform your behavior to be able to move the needle for individuals in the community will be pretty critical. So I see that we're running up to our point in time that we wanted to leave available for questions. So, next steps with these tools in hand, now you can start thinking about measuring what matters, defining and deciding what your outcomes are. Then what we'd certainly like to do is invite you to join us for the next session. Well, we'll start doing a bit more of a deeper dive into the nitty-gritty, what data you might want to think about, assessment tools, workflows, how you begin incorporating measurement into your environment, and that will be the second in our four-part series. So at this point, I think that we're going to see if we've had any questions that have come through our presentation. During our presentation, we have about 8 minutes to answer anything that's come up. Daniela, back to you.
Thank you so much, David, and thank you, Naomi. You guys did an excellent job of helping people to understand this what can be a very difficult idea. So we do have a few questions. Let's get started. And then while we're doing the Q&A, please, I encourage participants to use the chat box and chat in other questions. So we do have a few. So the first one is, I can see a drop-in center serving people that want to get out of the cold, but I don't think payers will see the value in this since no long-term behavior is changed. So it's more of a statement than a question, but I think we can sort of talk about the value of what that service is and how that might impact other services and population health in general, right?
Sure. Naomi, you want to?
This is Naomi. I guess in thinking about that, I would see that as kind of like a defibrillator, right? It's a life-saving measure. People don't want to just get out of the cold because, they'd rather be in the Caribbean. They get out of the cold because it's life-endangering to be out in the cold. So I don't think that's the piece of it. I think it's more about the long term. When they come in out of the cold, what do? You're providing them with nutrition. So that may feed into something. You may be connecting them up with other social services. You may be providing them with access to longer term housing opportunities. You may be providing some counseling around employment opportunities or other things that do effectuate that longer term condition or status change. So you don't only have to affect someone's unique behavior to have a valuable outcome. I think there's a whole bunch of pieces.
Yeah, and I'd only add to that is I think that as we walk through this presentation, I hope we made clear that outcome measures are just not to focus only on the payer. Outcome measures focus on other areas, and as Naomi said, then you take that getting people in out of the cold, and you redefine or you define your value of the other kinds of interventions and supports and services that you can provide at that touch point that really benefits in the long run the payer. It's maybe a little bit different argument and more difficult argument to make, but it certainly can be made.
Okay.
Something else, Danielle? Mm-hmm.
Yep, we've got some more coming in. The next one is, can you direct us to a sample value proposition so that we can see an example of how one would be put together? And before you guys answer that question, I would like to make a plug because after this outcomes webinar series is finished, 2 weeks after that, we are actually going to be hosting another webinar on value propositions and how to put one together. So stay tuned for the MCTAC Digest for registration information on that. But if you guys want to just address that real quick.
Well, off the top of my head, I don't have anything specific. I think that a simple Google search on value proposition, and you will have more than enough information that you might be able to use. I don't know. Naomi, do you have anything specific that you can point people to?
No, I think the concept of value proposition is gaining some traction in the behavioral health world. Where I think it's been done a lot more aggressively is in the for-profit world. If you look at, there's a woman named Melyn Sight, M-E-L-Y-N-N space S-I-G-H-T, and I think her company is called like Insight Marketing with the letter N, S-I-G-H-T, Site Marketing. If you Google that, I think she has a whole bunch of articles on value propositions and has some interesting stuff about like Apple computers and the difference between a mission and a value proposition and other things. But I think Dave explained it really well in that it's partially about what distinguishes you from your competitors, right? Yeah. And to create a value proposition, it's not about what you think you do well. It actually it's not about that. It's about what your consumers want, and your consumers may be your payers or your clients or family members or whatever. But what do they want, and how does that match with what you give, and then what's your special sauce that's added in that makes you different from everybody else who's also offering clinic services, for example.
Okay, thank you.
Yeah.
So it looks like we have time for just a couple of more questions. This one speaks to an agency that is just rolling out an EHR. They're looking for suggestions about what data they can collect, thinking ahead towards value-based payments in the future. So what's a good place to start at?
This is David. I think that well, a good place to start, I think, is first of all going through a process that we've talked about. Is begin defining who you're serving, what you're doing, what the outcome measures are. I go to the two documents that I highlighted at the end of my presentation that begins to, I think, provide guidance for individuals around what the state is going to be looking at as in part of the value-based, what the MCOs are going to be looking at, what the federal government is looking at. I think if you take those, you'll get a really pretty decent feel for what your future may look like, and then bring that down to begin saying, okay, you can't start with collecting 50 things. Because you'll get overwhelmed. So, what are the 5 things that we think are going to be critical to us going forward, and then how do we bake that into the standing up of our EHR to assure that we get the input into the system and then we can get the data out of it?
Okay, thank you. And then one last question. As you roll out logic models, for example, do you have any suggestions about how to help staff or managers see this as an important tool rather than more work? I think this is a really good question.
Naomi, I'm going to give you that one.
Oh, thank you, Dave. Thank you. Yeah, okay, it's more work. So I was going to say just suck it up. I think the reality is that it's one of those, I don't know what the expression is, but a penny saved is a something spent or whatever. If you think through up front what your logic model is, and again, a lot of us have to do this for different kinds of funding proposals, so some of us have already been doing it. Once you put that in place, then that guides your efforts, right? So if you, for example, said that I am looking to, my program is looking to, say, help come up with some, making an impact on something having to do with diabetes. I'm going to go back to the A1C thing. That means that I need to be sure that my activities include something that's going to hit those A1C levels, right? I can't get the outcomes I want without doing that work. So it helps in your design of what your program model looks like. That would also theoretically guide your need for additional staff or to change your staffing patterns, right? You can figure out additional funding resources. And yes, I realize I'm going off topic and it's not about saving work, but it does allow you to work more efficiently and perhaps with more funding because you can document what is needed to achieve X outcomes. So maybe get paid more.
I know we're running out of time. The only other thing that I would add to that is that we start with, these kind of projects with, what is our goal? And our goal is to provide better services, to increase the value of the services that we have, to really sustain the organization. So what we try to do is really communicate and educate our staff about what's the end game here. And the end game here is to do exactly what you want to do, which is to provide better services to our consumers. And sometimes that requires work, but if your focus is on doing better at what you do, I think that you find that you can engage people a little bit better. So, Daniela, you want to close us out?
Yes, please. So again, I just wanted to say thank you to all of our participants today. We actually didn't even get to all of our questions, so we're going to try to reach out to you individually and just send you an email with some answers if we can. And I just wanted to, again, thank David and Naomi for presenting today. And we hope to see you again in 2 weeks on Wednesday, April 5th from 1 to 2 p.m. For the next part of our series on how to collect data. Thanks so much, everyone. Have a great day.